town.
Hi, I'm Emily Mitchell, Director for the Council on Aging. I'm here on Friday, March 20th with Susan Jusell, the town nurse, to give you some updates on coronavirus. As we learned yesterday, we have the first presumptive positive case in the town. Sue, can you tell us what it means that we have a presumptive positive case here?
So a presumptive positive case is treated the same as a positive case. What we would do is notify the patient through our disease surveillance team, through the state, our local region, and our local public health here in Harwich. They will collaborate together to be in touch with the patient, to be in touch with their family, neighbors, or close contacts, and try to notify them on what they should do to monitor their own symptoms or to self-quarantine, or just to give them a notification that there's somebody that's been sick and maybe not to continue to go in and out of their space if they are then sent back home to self-quarantine versus staying in the hospital to monitor symptoms. If you were in a location that this person was known to be and they were unable to notify you personally, say it was in a large mall type of setting, and they were unable to notify you, they would then notify the public at large, put a general announcement out in every way that they could to get the notice out to as many people as possible, and then continue to notify people that they may have been in the same space as this person over what period of time.
So it's safe to say that if you haven't been notified yet from this case, that there's no increased reason to be fearful.
That's 100% correct.
Excellent. So we're still taking our normal precautionary steps to take care of ourselves and each other. And so what are some of the signs people should be on the lookout for if they think they might have coronavirus?
So some of the signs they would be looking for is, first of all, if you are known to be exposed to someone that has a presumptive or positive case of COVID-19 or the coronavirus is the same thing. You see them used interchangeably. You are looking for a fever, low grade or high fever, a cough, or shortness of breath. At this time, you need to know what your normal is. It's also allergy season. It's hard to manage the difference, but you do know when you are not feeling well versus what just general allergies feel like. If you are in question and you have 1, 2, or 3 of these symptoms, a fever, cough, or shortness of breath, we are recommending that you do call your primary care doctor. If you do not have a primary care doctor, in addition to calling your primary care doctor, we're looking to have people call the 211 line.
Great.
Yep.
And the 211 line, can you tell us about that? So you can call, but you can also access it online, correct?
I believe it is www.211.org if you are looking to access it online. It is easy to use. They've made it easy to use. It's a 211 line. It is if you feel that you may be at risk, to give them a call. They have people manning those lines. They're educated and ready to go through the process of questions to identify if you should be tested. And that's truly the purpose at this point of using the 211 is to give you the direction on how to be tested and to give you the permission to be tested. The testing is by priority. It is to keep our general public as safe as possible and to find the highest risk people to be tested. The 211 line may be, it's always being manned at this point, 24 hours a day. You may not be able to speak to somebody the moment that you call in. They take callers in queue. If you want to leave them your number, they will get back to you. There are times you'll get through rather quickly, and there are times it may be a number of hours before they get back to you. But do know that if you left your number, you don't need to call them again. They will be getting back to you.
What a great resource. I'm glad that they've established that, staffed by experts and available all the time.
We are lucky.
Yes.
Yep.
So I know a lot of folks will be able to manage their symptoms at home if they're not experiencing severe symptoms that require hospitalization. And I know you brought this great resource in to describe some of the steps people can take to manage their symptoms at home. Do you want to go through it with us for the public?
I think we should. Yeah. So 10 ways to manage your respiratory symptoms at home. So if you have a fever, cough, or shortness of breath, call your healthcare provider. They may tell you to manage your care from home and then to follow these tips.
Great. So number one, stay home from work, school, and public places. Ride sharing, transportation, those types of things. We really want to prevent the spread if you're having symptoms. Monitor your symptoms carefully, and if they get worse, you should call your healthcare provider right away. Number three, same thing as always, get rest and stay hydrated. That self-care goes a long way.
Yeah.
Number four, if you have a medical appointment, you should call your provider ahead of time. A lot of places are stopping people from walking in or coming in without checking in so they can prevent the spread of disease in the office. For number five, for emergencies, call 911. Tell dispatch that you're having symptoms, and our first responders will respond appropriately.
Also, if you are symptomatic, be sure in your own home that you are covering your cough and your sneezes, leaning into your elbow, keeping a tissue handy, something that is disposable, not to be using a handkerchief or something that will be used over many times. Wash your hands often with soap and water. They say for at least 20 seconds. For years, I've been doing it for 30 seconds, and I don't think anything of it. We are looking at using some warm water or hot water with lots of soap. You want to see bubbles on your hands. You want to be washing your hands like this. Think about yourself going into surgery. But this is a great time to work on hand washing for the rest of your life if you've not been an avid hand washer. You want to be washing your hands. You want to be washing between your fingers. You want to be washing on top of your hands. And once a day, be sure you clean underneath your nails, preferably at the end of the day or maybe again in the middle of the day. But keeping your hands clean is very important. With the soap and water for at least 20 seconds, people talk about singing happy birthday or the alphabet, whatever you're used to doing, but some tune that lasts for about 20 to 30 seconds. If you are unable to wash your hands, and it is definitely best to wash your hands, then use an alcohol-based sanitizer that contains 60% alcohol if you still have some at home. That's usually best to be kept when you're outside of the house and using your sink to wash your hands. After you've washed your hands, it's good to have a Lysol spray or a disinfecting wipe to then clean the sink back down, and that way you're maintaining a clean environment. As much as possible, stay in a specific room away from other people and in your home. Also, you should use a separate bathroom if it's available. If you need to be around other people or outside the home, wear a face mask if you feel that you have any respiratory symptoms. We'll talk a little more about that versus using a face mask and going out. We are trying to offer other options there, but truly to cover your face when you are around other people, and particularly if you're preparing food for someone else. Avoid sharing personal items with other people in your household, like dishes, towels, and bedding. Clean all surfaces that are touched often, like counters, tabletops, doorknobs, and other things that you're touching often. Clean your bedding often. Wash your sheets, maybe even every night. Change the pillowcase, just to keep up with very good personal hygiene at this time.
Great.
Yep.
So those are the ways you can help manage those symptoms at home. And again, if things escalate, it's always best to get back in touch with your healthcare provider, and they can guide you from there. Sue, can you remind us where the testing sites are if people need to get tested, and what protocol they need to follow for that?
Yes. So we do have a couple testing sites here on the Cape. It is very important that you understand you cannot just show up at them. You will not be accepted to come through. The testing sites are by prescription only. Either your doctor or the 211 line is the avenue to be getting a prescription to come in and be tested. If you are asked to be tested at Cape Cod Community College, they will give you directions on when to go and how to obtain the script, and that they will be ready for you to be there at a particular day and time, and be ready to serve you and see if you are appropriate for testing. Your doctor and your 211 line will help you manage that. If you are a patient of Outer Cape Health, they have their own program for testing. Again, Outer Cape Health is not having people come in for testing, but are managing their own clients on their own. So if you are a client of Outer Cape Health, please call your primary care doctor there and leave them a message. They will get back to you.
Great. Thank you, Sue. Was there anything else you wanted to share with folks about symptoms, management, protocol, anything like that that you think the public should know?
I think everybody is aware of what they should be doing to take care of themselves. In addition, do you want to discuss a little bit about what we're doing here?
Most definitely. So at the COA, we do still have staff on site, even though the building is closed to the public. We are offering help with getting essential groceries, medications, and meals to folks. So don't hesitate to give us a call. Our phone number is 508-430-7550. And if someone doesn't answer, we'll get back to you soon, I promise. That is Monday through Friday that we're available to respond to those calls. So we're really trying to make sure folks have their essential needs met, and we're here to answer your questions and provide support along the way. I do want to emphasize we knew that we would have a positive case in town. The town is prepared. The COA is still ready to help in any way that we can. So don't hesitate to reach out. Don't feel like you're alone in this. We're here and we're going to get through it.
Yeah, and there's things that you can be doing to take care of yourself. When you're looking at boosting your immune system, you want to be eating a variety of fruits and vegetables, different colors, full of antioxidants that help us fight from any kind of infection. Exercise, if you're at home and you can't get out and walk, if that's difficult for you to do, you can put a couple of paper plates on the ground and put your feet on the paper plates, and you can just skate in place and get your heart rate up a little bit by doing that. You can use some cans, and you can do some exercises with your arms using a little weight resistance with a tomato soup can. In addition to a little bit of exercise, just some deep breathing. Being sure that if you're not out walking, that you're taking good deep breaths, even just 3 times a day. Or in between a commercial, take one good deep breath where you sit up nice and tall and you breathe in for 4 seconds, hold it for 4 seconds, let it out for 4 seconds. And that way you're able to really take a good deep breath and clear whatever is in your lungs. You can even, instead of just breathing out, you can cough just to really clear your lungs if you're not exercising throughout the day. It's a great way to exercise your lungs. If you are doing some deep breaths, no more than 3 deep breaths at a time, or you might feel a little lightheaded or dizzy. But keeping yourself hydrated, I think everyone has told people that. If you think you're drinking enough, you may not be. You probably are not. So 1 cup of coffee counts a day towards hydration. After that, it needs to be non-caffeinated beverages. Anything that it is that you enjoy drinking, just try to keep drinking. And unless you're on a fluid restrictive diet, really try to drink 6 to 8 glasses of something a day. And if you can find some humor, we've got some great sitcoms on TV. You might even find some old I Love Lucy reruns. But laughter is great for your immune system. And if you're not somebody that sleeps very well at night, but you know that you feel tired at 10 o'clock in the morning, or you feel tired at 6 o'clock in the evening, and that's when you think you can get your best rest, that's when you should rest. Whenever your body feels tired and you are ready to rest, that's when your body's going to build your immune system. So you want to be sure to get enough sleep.
Aren't we lucky to have Sue? I know I wouldn't come up with the creative exercise solution, so I'm very thankful to have her. We're very lucky as a town to have her.
So lucky to be here.
And we'll be in touch. We'll be giving you updates as we have them. And again, don't hesitate to reach out. And we look forward to seeing and talking to you all very soon.
Take care.